Colleagues, the next item, kama nilivyosema, it's going to be a presentation from Dr. RISHA. Dr. RISHA comes from Access family, and he's going to present on inspiring excellence in quality through the safe care methodology, sharing on experience and lessons that have been learned from Tanzania and beyond. So, karibu sana, Dr. RISHA.
So I would like to, first of all, to give a background of Access. As the moderator says, we are 20 years old, based in Netherlands, and our mission is to improve access to quality health care in resource-constrained countries using innovative approaches. And what do? We have different approaches. We know that we have to apply to address both the supply and demand side. From the demand side, we need to improve people's ability to access care. How? We know that the most sustainable approach is to have risk pooling, so that when you are sick, you can access care even if you don't have money. So we do a lot of work on creating risky pools, motivating communities to engage in health insurance. And at demand side, we work more on supply side. We want to help health facilities to improve. What do? We mobilize private capital to loan to private healthcare owners so that they can improve access and quality. And more than that, we need to support the healthcare facility owners to have a standardized way of improving quality. So we developed standards for quality care based on best practices, and we work with facilities in a stepwise manner to improve quality and towards excellence in quality healthcare. And together with this, we do research to see what works best, and also we use digital innovations as enablers for efficiency and effectiveness. And the two presenters have already said this in a very strong voice. Quality of care, more people are dying from lack of quality rather than lack of access. And in access, particularly self-care, we believe that everyone have the right to access the highest quality of care. And we know that healthcare providers can be inspired to improve quality despite resource constraints. So it is just how do we approach that? And we did kind of a situation analysis, and we noted that healthcare providers struggle to improve quality due to lack of knowledge about the standards, because there is a belief that adhering to best practices is very expensive and not achievable. But if we give proper guidance, this can be surmounted. We know that the gold standard for quality care is accreditation. But in these countries, in our countries, international accreditation is very expensive and is a big challenge. And for Access, we are looking on how can we develop a business model which can lower the cost drivers so that international accreditation is achievable even within the resource constraints. And that lack of standard and also lack of quality stamp makes the quality unknown. And we cannot benchmark. Most people will if people get sick, you don't know which facility to visit because you are not sure of the quality. There's no transparency, there's no benchmarking. And as a result, patients cannot vote with their feet. And there's no motivation for providers to improve quality. So, from Access Safe Care, developed standards that can be used to have impact on quality of care. And these standards we intended that they can be used from primary healthcare facilities to consultant hospitals. So all the spectrum of healthcare facilities. And we focus on solutions which are achievable so as to improve quality. We wanted to inspire progression, that whatever you do to reach a milestone, we recognize so that you are motivated to continuously engage in quality care. And we took in consideration resource restrictions in our countries where we work. And so we also provided a possibility of benchmarking quality, where we said that we should recognize different levels of quality, starting from the lowest level, meaning that highest risk to the patient, to the highest level of quality, level 5, where there is excellency in quality, and this provider is ready to go for international accreditation. So that is the model we developed, that using standards to impact quality. And since 2011, when we developed these standards, we have been implementing in 4 countries, extensively in 4 countries in Africa, in Ghana, Nigeria, Kenya, and Tanzania. And now we are very well recognized. We are going to Pakistan, India. We are always being asked to go to provide this model which have been shown to work. And in Tanzania, we have worked in every region. We worked with our partners, the Association of Private Health Facilities, AFTA, the Christian Social Services Commission, CSSC, and the government. So working in both private and public health facilities. And I would go, what are our observations in our efforts to improve quality? We work in more than 500 facilities, so this is quite a big number in every region. And what we saw is that using this standards-based approach, the safe care methodology, can really bring change and can improve quality. But where are the most of the improvements are not in the clinical part. And is this only in Tanzania? We are getting similar results from other countries as well. We see improvements are going on slowly. We are improving only structure and not mostly on clinical part, which would lack. So our lessons are that improvements take time. It is not a touch and go. So it is a journey. Also, providers address first the lowest hanging fruits. And what we need is to create a value proposition. To get out of this slow improvement is create a value proposition to different stakeholders, promote visibility of those who really invest in improving quality, and also motivation of healthcare workers to change attitude, because quality improvement is mostly attitude. We know that hand washing is very important in providing clinical care, but how many do proper hand washing? So we think that behavioral change is very important and key to motivating and stimulating and accelerating faster improvements. And one of the approaches is use a mobile-based technology where you can engage healthcare workers to always address the quality gaps which have been identified. I have a mobile phone, and when I walk, they say, okay, you are now 400 steps, your target is 600, so you are almost there. So we are using similar approaches, that you have 50 quality improvement activities. For this week, you have not touched your quality improvement activities, so you are motivated. You are, another message will come now. You have addressed 49 of all 50 facilities, and you are ready to go to the next step. So we are using mobile technology to engage, to stimulate healthcare workers to engage in quality improvement. Together, we also provide visual tokens that can stimulate like achievements made. Like if you have addressed, you are the first in your peers to address all lab-related activities, infection prevention and control activities, you get a badge. And if you have got the fastest implementation, you get a badge. And our experience in the 4 countries, we have seen that we can get faster improvements. We are also thinking now, how can we have strategies to improve clinical care? And for the next 5 years, this will be one of our focus. Another strategy which we are working with is to make accreditation, international accreditation, achievable within the resource constraints. So our work was to develop a business model which will achieve this. And how do we go that? How do we go about? We know we have invested for the last 10 years. We have standards for accreditation. We have in-country capacity, and we have a function data processing system. So with this, we can work with this to reduce the cost drivers for international accreditation. And one of the cost drivers is flying consultants from abroad to do international accreditation. Now we have the capacity, and we think with this model we can make accreditation